Good morning. My name is Maria Cristina Fuentes, and I'm the Director of the Governor's Office of Youth, Faith, and Family. I am so grateful to be here this morning, joined by Dr. Kara Christ and a number of faith leaders who are here to share their perspective on the COVID vaccine and why it's important for all of us to be vaccinated when our turn arrives. I'm especially thankful to Dr. Warren Stewart Sr. for his voice, his leadership, and for housing us in this beautiful church today. Dr. Stewart is a leader in our city and in our state, and most importantly, a leader in the African American community, which we know has been especially hit hard by COVID. Thank you, Dr. Stewart, for hosting us. I also want to thank Reverend Katie Sexton and everyone at the Arizona Faith Network for helping us put together this event today, and for the pledge they released yesterday, urging all Arizonans to get vaccinated, and echoing our request to the federal government for additional vaccines to our state. Arizona faith leaders have been instrumental in supporting communities statewide, offering care, compassion, and comfort during these challenging times. We are grateful for all that they continue to do. The governor, Dr. Christ, our office, and many other state leaders have been in regular contact with faith leaders and faith groups throughout our state, as they have played an essential role in communicating critical updates and supporting our communities through this incredibly difficult year. We are grateful for your service, and we cannot succeed without the work that you do. Now I'd like to introduce my dear friend and colleague, Dr. Kara Christ, to give us an update.
Thank you, Maria. It's my privilege to participate in this event and to be able to vaccinate this group of leaders from Arizona's faith community. Hundreds of thousands of Arizonans have already made the decision to get vaccinated against COVID-19. We are pleased with the obvious demand from others who are eager to follow them. Our event today looks towards a time when there are enough doses available for everyone to get vaccinated, and not just at mass vaccination sites, but at pharmacies and doctors' offices. When that day arrives, some people will still be deciding whether to get vaccinated, and they are likely to look to those they know and trust when making that decision. The importance of religious leaders in speaking to the safety and effectiveness of COVID-19 vaccines cannot be understated. As their turns come in the vaccination priority, I hope more and more leaders like those today share their experiences and encourage others. That's because we need as many people vaccinated as possible to develop the herd immunity needed to return to gatherings safely in all settings, including religious functions. The doses we'll receive today are made by Pfizer, which requires a second dose 21 days after the first vaccination. Many across Arizona will receive the Moderna vaccine, which requires a second dose 28 days after the first one. As with many vaccines, some of those being vaccinated today may feel side effects. For this vaccine, side effects can include pain at the injection site, fever, fatigue, headache, chills, and muscle and joint pains. But it's really important to note that these side effects are normal and signal that your body is producing an immune response. When I received my first dose, my only side effect was some normal soreness at my injection site. When your place in line arrives, I urge you to get vaccinated. These vaccines are the light at the end of the tunnel, and vaccines are one of the most effective public health tools for controlling diseases, whether it be influenza, measles, or whooping cough. Because it will be a number of months before vaccine is available to all, we must continue doing all that we can to mitigate the spread of COVID-19. We must continue taking precautions every time we're around people who aren't members of our household. This includes wearing a mask over your nose and mouth, maintaining at least 6 feet of physical distance, washing and sanitizing your hands often, and staying home if you are sick. Avoiding crowds is also very important. Even with the need to continue these precautions, today's event gives us one more reason to be optimistic. It also gives us another reason to look to our federal partners to get us enough vaccine to give everyone the chance to follow this group and get vaccinated. I'm so grateful to Dr. Warren Stewart for being our host pastor today, and invite him to the microphone.
Greetings and welcome to the First Institutional Baptist Church. God is a healer, and God often uses medicine to heal. I want to thank Director Fuentes, Dr. Kara Christ, and my fellow faith leaders for being here this morning to help raise awareness about the importance of the COVID-19 vaccine. Over the past year, our communities have been devastated and dealt with many challenges brought on by COVID-19. So today we look to the future with a sense of hope, thanks to the vaccine and to our faith. To date, over 600,000 doses of the vaccine have been administered in Arizona. This is incredible work, and I want to thank Dr. Chris, Governor Ducey, and every healthcare worker across the state who has stepped up to support our communities and provide service, care, compassion during this time. While vaccine doses continue to be administered across the state, Arizona's vaccine supply is limited. Today, I join leaders from all across Arizona in our state calling for our federal partners to take action and ensure that we have the numbers of vaccines on hand so that all Arizonans are able to receive the vaccine quickly. When it is your time to be vaccinated, please do. This is a critical step in getting back to normal, to hugging our loved ones, to having the ability to come together and sit next to one another in worship every week, and to rebuilding our sense of community. So until your time to get your vaccine, please continue to use mitigation strategies to keep our communities and loved ones safe. Wear your mask, physically distance, stay out of crowds. Thank you very much.
Now it's time for Dr. Stewart to get his vaccine, first vaccination of our day. Which arm are we doing? That one, okay. The hardest part about this is getting the gloves on. After the sanitizer.
That was easy. Bless you.
Thank you, Dr. Stewart, and thank you, Dr. Chris. Dr. Chris has a reputation for a magic touch with vaccines. I think lots of practice. Next, I'd like to invite up Pastor Larry Farley, lead pastor of Global Outreach at Christ Church of the Valley.
Thank you. Well, thank you for being here, and I would just like to say from the heart of our church, a big thank you to the health professionals that are working through this pandemic and to Governor Ducey's office. And to send a message to all those working on this pandemic that our church is here for you. Please do not hesitate to reach out, and we'll take whatever resources we can to come alongside you. Thank you.
Thank you, Pastor Farley. Next, I'd like to invite up Bishop Eduardo Nevares of the Roman Catholic Diocese of Phoenix.
Thank you, Maria. I have already received my vaccine, but I want to encourage everybody listening to please do so because it can save lives. And if you want more information, please check out the webpage for the dioceseof.phoenix.org. We have a lot of information on the vaccine and a lot of very informative material. Yo ya recibí mi vacuna, no lo voy a recibir hoy. Quiero ofrecer mi apoyo para esta vacuna, para por favor recibirla tan pronto posible, porque sí salva vidas. Si necesita más información, vaya por favor a nuestra página web www.diocesesdephoenix.org. Dios le bendiga. God bless you.
Muchísimas gracias. Next, we are inviting up Dr. Gloria Smith, who is the Reverend at Encanto Community United Church of Christ.
Good morning. I'm here this morning to say yes to life. And in saying yes to life, I also share my appreciation by being part of a community that'll help hospital staff, healthcare providers, their families return to normal life. They have given us so much. To say yes to science. Science has given us great minds who have accumulated knowledge over the years, and we're able to rapidly develop this vaccine for us. I'm here to say yes to life, to honor those that we have lost, and to offer hope to the families who have had to grieve alone, and to offer hope to those who have lost their jobs during this difficult past year, that they can look forward to having a safe environment, a healthy environment, and a way to take care of their families. So I ask you, trust the science, thank God for the inspiration they received, trust science, take the vaccine, choose life. Thank you.
Next, we're inviting Bishop Jennifer Vidal, the 6th Episcopal Bishop of Arizona.
Thank you, Director Fuentes. So I follow a Jesus who is a healer, and as a healer, Jesus cared about the health of every single person. In my prayers, I have been giving thanks for all of the scientists and all of the years of education that helped give us this vaccine, the decades of research beforehand that laid the foundation so that they were able to manufacture it so quickly. And I encourage everyone to get vaccinated as soon as you're able, because it's a way of loving your neighbor. When you get vaccinated, you're not just protecting yourself, you're contributing to all of us being able to go back to school, to go back to worship, to go back to work, and to being able to live our daily lives. So love your neighbor, get the vaccine. And I introduce Padre Enrique Cadena of Iglesia San Pablo.
Muchas gracias por estar aquí. Quiero invitar a toda nuestra comunidad latina a que no tengamos miedo. Es importante que todos recibamos la vacuna y así vayamos creando una barrera de protección contra este virus y sea para toda nuestra comunidad. Gracias.
Thank you, Bishop. Now we're inviting Pastor Gary Kinnaman, former senior pastor of World of Grace, which is now known as Hillsong Church.
Keep my glasses from fogging up. I just want to say that this is a real problem. It's amazing to me how many people don't think that this is a real problem. It's a real problem. I can't tell you how many people I've heard about who have had COVID, who have died from my pastor friends. This is a real problem, and this vaccination is a real solution. And I'm grateful for that. I'm grateful to be a part of this, and thank you all for being here and making this a citywide event. Is it going to hurt? Oh, I'm sorry. Well, should have worn my tank top. Okay. No. Okay. Are we going to do the vaccine?
Yeah.
I didn't feel a thing.
Painless. Great. Thank you so much. Next, we're inviting up Rabbi Linder, who is our rabbi at Temple Salel.
Needless to say, as people of faith, we have been praying overtime for relief during this devastating year of the pandemic. We express gratitude to God for endowing us with the wisdom to create and innovate. In this case, the marvel of science to create vaccines that save lives. I join my clergy partners this morning as Rabbi of Temple Salel with our President Doreen Feldberg, and as a leader of the Valley Interfaith Project serving on the governor's COVID-19 task force. We are here to say our prayers have been answered. Thank you, God, for our brothers and sisters toiling in research labs to bring these vaccines to us today. Now it's up to us. We will only get over the hump of this pandemic safely back to work, in classrooms, in the pews, in restaurants and hotels, and back into the arms of our loved ones by doing our part. We urge you, when you are able, sign up and receive the vaccine. They save lives. Save yours.
Okay, next we have Reverend Al Beasley, who is Reverend of First Christian Church of Globe.
Good morning. In John 13, the disciples and us as disciples heard a new commandment. That commandment was love one another. We have been showing our love for one another since March by staying away from one another, by wearing masks, by social distancing and sheltering in place. We are here today for another way that you can love one another by getting vaccinated. So I encourage everyone, all my folks in Globe and all the folks around Arizona, when it is your time, please show your love for one another and get vaccinated.
Next, we're inviting up El Reverendo John Martinez, who is here to represent us with Hispanic Christian communities.
Dios me los bendiga a todos ustedes esta mañana. Este es un día histórico. Estoy aquí animando a la comunidad hispana y les quiero animar que por favor tomen la vacuna. Es para nuestro bienestar. Es gratis, es para todos, inmigrantes incluyendo. Los animo a que tomen la vacuna porque va a ser mejor para nuestra comunidad, nuestro estado, nuestra nación. Tomen esta vacuna. No hay efectos, está bien. Yo lo voy a tomar para que miren que está segura esta vacuna y queremos que se mejore nuestro estado, nuestra nación. Que Dios me los bendiga, Dios me los guarde y que el favor de Dios esté con ustedes.
Muchas gracias. And finally, we're inviting Dr. Benjamin Thomas Sr., who is the Reverend of Historic Tanner Chapel African Methodist Episcopal Church.
Greetings. I am truly honored to be here to represent the African American Christian Clergy Coalition as well as Historic Tanner African Methodist Episcopal Church, the oldest African American church in the state of Arizona. And we want you to know that the Word of God in Jeremiah chapter 8 asks the question, is there no balm in Gilead to heal a sin-sick soul? God provided for us years ago a remedy for our sins through Jesus Christ. And for centuries, that blood has covered and kept us. And now we find ourselves in the midst of COVID-19 pandemic. And God has worked through the minds and the hands, the intellect of science to help bring about a virus to heal a pandemic that has attacked our souls, our bodies, our minds, causing fear in our community, isolating us from our families and from our friends. And God has provided through their hands and through the discovery of vaccine that can help recover our nation. Christ is recovering us, covering us with his blood from our sins, and now the vaccine prayerfully will be able to put us back together with friends, family, and loved ones. The African American church has been known for years to have the pastor be the spokesperson, a key messenger that can be trusted within the church to encourage and to educate the members of their congregation to take care of themselves wisely, their health, as well as their mental health and spiritual health. We're encouraging and engaging the members of the African American Christian Clergy Coalition and our brothers and sisters across the state of Arizona to help educate and encourage the members of our congregation to receive this vaccine as soon as it is available. We're also, as Dr. Stewart shared with us earlier, encouraging science in the state to make sure that the vaccine is available not for a few, but for everyone. So today I take my shot so that you would have an opportunity to feel free and be encouraged and not be afraid to take your shot.
so much. And for our last speaker, we're inviting up Rock Arnett, who's a representative of the Church of Jesus Christ of Latter-day Saints.
Thank you very much. I'm delighted to have been invited by the Area 70 of the Church of Jesus Christ of Latter-day Saints, who represent the church, to come here to support this event here today. As you may be aware, the Church of Jesus Christ of Latter-day Saints has long supported vaccinations and helping eradicate communicable diseases across the world, polio and measles and other spreading diseases. And when the COVID-19 issue came about, we immediately responded as good neighbors, and our chapels and our temples were closed and then went virtual and have tried to be good corporate citizens. As well, the presidency of the Church of Jesus Christ of Latter-day Saints, the three gentlemen obviously are older than 75, and they have all been vaccinated, and the senior apostles have been vaccinated, and encourage others throughout the church to do the same. We understand that medical advancements has helped this come forward, and we stand ready to support this experience going forward. And we thank the state and the medical providers and all who are helping eradicate this pandemic. Thank you very much. Thank you for being here today. Thank you.
I really like that everyone has remarked how painless the shots have been. I could not be more grateful for this today, for everyone taking the time to be here, for all of you being here to watch and listen to these incredible community leaders. And there's hundreds and hundreds, if not thousands more leaders across a multitude of faiths that we're in constant communication with, who are critical best partners in continuing to communicate to their various communities the importance of getting the vaccine, the importance of continuing to deploy the mitigation factors of washing our hands, wearing a mask over our nose and our mouths, keeping 6 feet apart from anyone who's not in our own household, staying home when you're sick, avoiding crowds. Together we can all help each other, and I think the messages that we heard today are very powerful. Love one another, take care of one another, and the vaccine is a surefire way of doing that, so please get vaccinated when it's your turn. Now I invite Dr. Chris back up to the podium for any questions that you may have for us.
Why don't we work our way this way?
Okay.
Hi there, Brianna Friends with the Arizona Republic. Dr. Chris, this morning's appointments, 21,000 appointments at Phoenix Municipal Stadium were booked within 39 minutes. So we were wondering if you know whether any appointments were booked over the phone and whether you think the online-based system is fair and is providing enough opportunities for people to sign up. And additionally, what would you say to people who are still struggling to get an appointment?
So we are excited about the demand that there is for vaccine in Arizona. We understand that the limited amount of vaccine is really causing some frustration. So we're working to try to make sure that we're getting vaccine to our high efficacy sites so that we can open up more appointments. I left the office to come here, so I don't have exact numbers, but we can round back with you after that.
Hey, Josh Sanders with 12 News. Dr. Chris, thank you. Dr. Fauci says we need to engage Black and Latino communities. There's a lot of conversations about equity, vaccine equity, and some of the faith leaders even spoke to that this morning. A recent report from the NAACP and COVID Collaborative revealed that just 14% of Black Americans and 34% of Latinx Americans say they trust the safety of the vaccine. Can you speak to equity and what you plan to do going forward beyond just this when it comes to engage those communities?
Absolutely. So we think that equity is a very important issue when it comes to vaccine, and we want to make sure that everybody has access, but especially those communities that have been highly impacted by COVID-19. So there's a couple of things that we're doing. We're currently working on a campaign to build confidence in the vaccine and directly message to those high-risk groups how important it is that when it's their turn to get the vaccine. We have engaged with some communications consultants to directly target high-risk zip codes and to go into those communities to utilize community leaders to talk people, or like person to person, to do town halls, to do marketing campaigns directly in those high-risk zip codes. So as the vaccine continues to roll out, you will see more and more of that. We will also be working to get the vaccine into those hardest hit areas by ensuring that we're using pharmacies that have access, like that those communities have direct access to, and getting mobile vaccination opportunities as well as community events in those communities.
To follow up, Dr. Fauci said one thing is messaging, the other thing is to acknowledge the history of what Black people and the Latinx community have gone through. What are your thoughts on the history? What are your thoughts on the Tuskegee experiments and what they've experienced historically that would make them be hesitant to take this vaccine?
Based on the history, we are understanding of why they would be hesitant. And so we're going to do everything we can to build the confidence that it's scientifically based, and really what we're doing is trying to protect them and save lives. That's why we are working with trusted leaders in the community, encouraging them to get their vaccine and to talk about their experience so that we can build that confidence up.
And last question, Super Bowl's coming up this weekend. Your thoughts on gatherings and why people should not?
So we know that when people are in comfortable, familiar settings, they let their guard down, especially when they're around people they love and trust. Our recommendation is still the same as it was over the holidays. If you are around people that do not live in your house, make sure that you have a mask on, you stay 6 feet away, and that you try to limit the number of people at the gatherings. I will likely be watching the halftime show at my home with my immediate family.
Hi, Chris.
Hi, Cameron.
We live in a multilingual community. A lot of folks only speak Spanish or only speak a certain language. They aren't going to get the same communication from people like myself who are on Twitter, answering questions every day, taking emails every day. How are we going to outreach to those folks who only speak Spanish? Because we know that there's a huge portion of those people, not only who fit in this priority group, but who aren't being communicated with in that proper way to know what's on.
So that's a great question, and one that with all public health messaging, we continue to struggle with. So we rely on your expertise working with our media partners that can speak directly to that community to get that messaging out. We do have a Spanish prompt on our call line. So if people need assistance in Spanish, they can access that as well. The other thing that we are working on is, again, working on that communication and putting it into Spanish using communications experts that deal directly with those communities to try and get the word out. The other thing that we're doing is we're working on a Spanish update to our website, and so that should be released shortly.
Are you reaching out to Latino clinics too? We know that there are Latino clinics here in town who are able to administer the vaccine. What kind of communications are you having with those clinics?
So we work very closely, just like we did in testing, with partners like Chicanos por la Causa and Equality Health, and we've been working directly with our community health centers, so those health centers that are in the community, to try and get them vaccine. Our barrier has been the limited number of vaccines that we have, but trying to get it out to where people can access it in their community where they're comfortable receiving their care. Thank you.
Any other questions? Please.
Hi, Dr. I have a question. Maricopa County Health said Tuesday that some unused coronavirus vaccine doses have been thrown out, a total of 553. I think it's important to explain to the community, especially the Latino community, why this happened, because a lot of people are concerned, and if we don't educate it, they might think they will waste it.
Right. So that is a great question. So wastage in the vaccine program world has a very wide definition. And so the things that people are concerned about, like the doses expiring or the doses just being thrown away, that is very, very different, and that is not what is happening in our communities. When we have to report to CDC, when our providers report to CDC wastage, they'll report things that may have been damaged in the shipping, or something happened to the syringe and the needle's bent and you can't transfer that dose to another syringe. There can be air in the syringe or in the vial that makes it unusable. It's really unusable vaccine that we're accounting for the wastage. So I thank you for the opportunity to clarify.
And following up with that,
Yeah.
do you recommend maybe family members going together if their loved one already has an appointment, and in case there's a dose there available for them to get vaccinated?
So here's what I would recommend, and I can only speak for the state-run vaccination sites. So we do allow, on an occasion, based on the clinical decision of the team at the site, that family members, based on whether they're a caretaker, what type of vaccine supply we have, and what the capacity is of the site that day, we will allow for people, our plus ones, to be vaccinated in the car. If there's 4 or 5 people in the car that don't have an appointment, that may not be able to be accommodated. Thank you.
Thank you. I'm Mike Conley with Channel 3, Channel 5. Can you explain briefly the improvements that the department has made to the website?
Yes. So we understand how frustrating our website was. We have been working on enhancing it and making it better based on customer feedback and our own personal frustrating experience with the website. So things that went into effect over the weekend and yesterday were, you don't have to search day by day to find an available appointment now. It tells you when the next available appointment is, but it also indicates other days that have available appointments. So that will save our customers some time. The other thing that it did was, I experienced this frustration, but you put in your information and you go to do something, and when you go back, you have to re-input your information. That has been updated as well, so that it saves your demographic information and you don't need to input it every time. Other things were that we moved the confirm button up to the top so people knew that there was a confirm button, as well as making it easier to do your birth date. You can select whether or not you want to do military time. A lot of the things that people were saying was either confusing or frustrating.
Thank you very much.
Thank you.
That's all the questions? Okay. Do you think at some point that you'll start, or are you looking at and tracking demographic data when it comes to, who you're giving, who's receiving the vaccine, and is that something that you plan or could release to the public?
Yes, so we are tracking that, again, with all of our data, that's self-reported data, but we are planning on putting that on our website. We're looking at the template now, and hopefully we'll get that up.
And just if you could just expand a little bit more, because I think, a lot of when it comes to this question of equity, a lot of the leaders on this say, yes, messaging is one thing, but really it's acknowledging what communities have gone through, not just the last 4 years, the last 400 years, especially when it comes to the African American community, and then for Arizona, the Latino community, the Native community. So could you flesh out for me the plans not only to bring messaging to those communities, but to actually acknowledge their experience to the way to where they're like, hey, I know that you hear me right now. I know that the state, ADHS, the governor hears me right now.
So we are in the process, we have done listening sessions with the community to identify where, what are the best messages to get those out. We are working with a leader in that community to ensure that we are having the right tone, that we look like we are listening, and meeting people where they are. So that is really one of the most important things. And absolutely, understanding the historical trauma that is there with our African American population, our Native American population, and our Hispanic population. There are a lot of things that we have to be able to overcome in order to gain their trust.
I have one more question about the demographics. Are you aware of how many people, what percentage of people are actually putting in their ethnicity into those filters?
We have those numbers. I don't have them right off the top of my head. I do know that we've got a lot of either unknown or other in there, pretty consistent with what the other data we're getting.
Okay, thank you, Dr. Chris.
Thank you.
That concludes our time today, and Dr. Chris and your team, thank you. We are also very grateful for the tireless and faithful work that everyone at DHS and health workers throughout the state have been doing, but especially you. So thank you.